Today we dive into health careers you may not have heard about. Laryngologist. A laryngologist is a specialized medical professional who focuses on diagnosing and treating disorders related to the larynx, throat and vocal cords. They are a subspecialist within the field of otolaryngology, also known as ear, nose and throat, or ENT. What they treat. Laryngologists manage a wide range of conditions affecting the throat and voice. These include hoarseness, vocal cord paralysis, vocal cord nodules, polyps, cysts and other lesions. They also treat dysphagia, which is difficulty swallowing, and conditions affecting the esophagus. Laryngologists deal with laryngeal stenosis, tracheal issues and other airway obstructions. They're involved in the diagnosis and treatment of cancer affecting the larynx. Additionally, they treat conditions such as laryngopharyngeal reflux, which can affect the throat and voice, and neurological disorders that impact the voice and swallowing functions, such as spasmodic dysphonia. Qualifications. To become a laryngologist, one must fulfill several qualifications. This includes obtaining a medical degree, either an MD or DO, from an accredited medical school. After medical school, a physician must complete a 5-year residency in otolaryngology, covering a broad range of ENT conditions. Following residency, additional specialized training in laryngology is typically required, usually involving a 1 to 2 year fellowship focusing specifically on voice, airway and swallowing disorders. Education requirements. The educational path includes an undergraduate degree, typically in a science-related field such as biology or chemistry. This is followed by 4 years of medical school leading to an MD or DO degree. After that, a 5-year otolaryngology residency provides comprehensive training in ear, nose, throat and related structures. Finally, an additional 1 to 2 years of subspecialized training in laryngology is required. Licensing. After completing medical school, one must obtain a medical license by passing the United States Medical Licensing Examination or the Comprehensive Osteopathic Medical Licensing Examination. After completing residency, physicians typically seek board certification from the American Board of Otolaryngology, Head and Neck Surgery. While not always required, many laryngologists obtain additional certification in laryngology, recognized by professional bodies such as the American Laryngological Association. Cytopathologist. Also known as an anatomic pathologist, these physicians specialize in diagnosing infections and cancers as well as examining pap smears for women's health. To become a cytopathologist, a specialized pathologist who focuses on the study and diagnosis of diseases at the cellular level, one must meet specific educational, training and licensing requirements. Here's a detailed overview. Educational path. First, a bachelor's degree is needed, typically in pre-med, biology, chemistry or a related field, which takes about 4 years. This includes coursework in biology, chemistry, physics and mathematics, along with participation in extracurricular activities like volunteering at hospitals or research labs. Next is medical school, leading to a Doctor of Medicine or Doctor of Osteopathic Medicine degree, which also takes about 4 years. The first 2 years focus on classroom and laboratory work, covering basic medical sciences, while the last 2 years involve clinical rotations in various specialties, including pathology. Residency training. After medical school, a residency in anatomic pathology is required, lasting 3 to 4 years. This training focuses on diagnosing diseases through the examination of tissues, organs and cells. Fellowship training. Following the residency, a specialized fellowship in cytopathology is needed, which lasts 1 to 2 years. This training involves extensive hands-on experience in examining cellular samples, including those obtained from pap smears, fine needle aspirations, and other cytological procedures. Licensing and certification. To practice, a medical license is required. This involves passing the United States Medical Licensing Examination or the Comprehensive Osteopathic Medical Licensing Examination and applying for a state medical license. Board certification is obtained from the American Board of Pathology, which involves certification in anatomic pathology after residency and subspecialty certification in cytopathology after fellowship. This includes passing both written and practical exams. Summary. The total duration to become a cytopathologist is approximately 13 to 15 years after high school. The path includes a bachelor's degree, medical school, anatomic pathology residency, cytopathology fellowship, and finally licensure and board certification. Gerontologist. Age isn't just a number. Advancing years affect every aspect of how the body functions, including digestion, brain function, how medications work, and more. Often working in collaboration with other specialists who treat specific conditions, a gerontologist is an expert in the field of aging, geriatrics, and all of the related cultural, cognitive, and biological aspects of this process. They help patients and their families cope with age-related changes. To become a gerontologist, specific qualifications, education, and licensing are required. Here's a breakdown. Education. First, a bachelor's degree in a related field such as biology, psychology, sociology, or social work is needed. Some schools offer pre-gerontology tracks or programs focused on aging. Next, a master's degree in gerontology or related fields with a focus on gerontology such as social work, public health, or nursing is often required. For advanced research positions or academic roles, a doctoral degree in gerontology or a related field is preferred. Medical doctors may pursue additional specialization in geriatric medicine. Specialized training and certifications. This includes a graduate certificate in gerontology for those who already have a degree in another field, internships or practicum for hands-on experience working with older adults, and certifications such as Certified Senior Advisor, Gerontological Nursing Certification, or Board Certified in Geriatric Medicine for physicians. Licensing for physicians. Obtaining a medical license involves passing the United States Medical Licensing Examination or the Comprehensive Osteopathic Medical Licensing Examination, followed by board certification in geriatric medicine after completing a residency in internal medicine or family medicine and a fellowship in geriatrics. For nurses and nurse practitioners, state licensure as a registered nurse or nurse practitioner is required, along with geriatric nursing certification. For social workers, the licensed clinical social worker credential is needed, which requires a master's degree in social work, clinical training, and passing a licensing exam. Specialization in gerontological social work is available through additional coursework and certifications. Continuing education gerontologists must engage in ongoing education to stay updated on developments in elderly care, ethical considerations, and advancements in the field. Skills: strong communication, empathy, problem-solving, and an understanding of the physical, psychological, and social aspects of aging are essential for success in this field. This combination of education, specialized training, and licensing equips gerontologists to effectively care for and support the aging population. Interventional radiologists are experts at shutting down blood flow to body parts when it is not wanted. When a patient has internal bleeding from trauma to a body part, such as the liver, kidney, or spleen, or a pelvic fracture, interventional radiology doctors perform embolization procedures that involve plugging up the bleeding vessels. These doctors also can reopen blood vessels that have shut down abnormally due to narrowing of the arteries or blood clots to the legs or lungs, for example. In addition, they embolize malignant tumors in the liver and kidneys, as well as benign overgrowths of organs like the prostate and uterus to shrink them back down to normal size. These doctors use X-rays, ultrasounds, MRIs, and CT scanners to guide many procedures throughout the body, from head to toe. Becoming an interventional radiologist requires extensive education, training, and licensure. Here's an overview. First, the educational requirements. A bachelor's degree, typically in a science-related field like biology, chemistry, or physics, is required. Courses in biology, chemistry, physics, and math are essential. After earning a bachelor's degree, you must complete a Doctor of Medicine or Doctor of Osteopathic Medicine degree from an accredited medical school, which typically takes 4 years. The first 2 years focus on basic medical sciences, such as anatomy, physiology, pharmacology, and pathology. The last 2 years involve clinical rotations in various medical specialties, including radiology. Next is residency training. After medical school, you must complete a 4-year residency in diagnostic radiology. This training includes learning how to interpret medical images and perform image-guided procedures. Following your diagnostic radiology residency, you must complete a 1 to 2 year fellowship, specifically in interventional radiology. This fellowship focuses on minimally invasive, image-guided procedures and the management of patients who undergo these procedures. You must also obtain a medical license to practice, which requires passing the United States Medical Licensing Examination for MDs, or the Comprehensive Osteopathic Medical Licensing Examination for DOS. After completing residency and fellowship, you must obtain board certification in interventional radiology. This is typically done through the American Board of Radiology by passing the necessary exams. In terms of skills and qualifications, proficiency in using imaging equipment like X-ray, Connecticut, MRI, and ultrasound, and performing minimally invasive procedures is essential. Attention to detail is crucial for precision in interpreting medical images and guiding procedures. Strong problem-solving abilities are needed to diagnose and treat complex conditions. Communication skills are important for explaining procedures and treatment plans to patients and collaborating with other healthcare professionals. Manual dexterity is necessary for performing delicate procedures, and stamina is required to work long hours and handle physically demanding tasks. Within the area of orthopedic surgery is a type of cancer doctor who treats bone and soft tissue tumors of the musculoskeletal system. Becoming a musculoskeletal oncology specialist requires a significant amount of education, training and certification. Here's a breakdown of the qualifications, education and licensing needed. First, the undergraduate education. A bachelor's degree, typically in a science-related field like biology, chemistry or pre-med, is required and usually takes 4 years. Next, medical school. You must earn a Doctor of Medicine or Doctor of Osteopathic Medicine degree, which typically takes 4 years. The first 2 years usually cover foundational medical knowledge, while the last 2 years involve clinical rotations across various specialties, including surgery, internal medicine, and oncology. After medical school, you must complete a residency in orthopedic surgery, which lasts 5 years. This training focuses on diagnosing and treating musculoskeletal disorders, including surgeries related to bones, joints, muscles, and tendons. Following residency, you must complete a 1 to 2 year fellowship in musculoskeletal oncology. This specialized training focuses on diagnosing and treating cancers of the bones and soft tissues, including limb salvage surgery, tumor resections, and reconstruction. You must obtain a medical license to practice, which requires passing the United States Medical Licensing Examination for MDs, or the Comprehensive Osteopathic Medical Licensing Examination for DOS. After completing residency, you must obtain board certification in orthopedic surgery from the American Board of Orthopedic Surgery by passing the board exams. Additional certifications include fellowship certification in musculoskeletal oncology after completing the fellowship. Continuous education and recertification are necessary to stay updated with the latest advancements in the field. In terms of skills and competencies, proficiency in complex surgical techniques specific to oncology is essential. A deep understanding of cancer biology, treatment modalities and patient care is also crucial. Involvement in research and clinical trials is often necessary to stay on the cutting edge of musculoskeletal oncology advancements. Some specialists may pursue further research opportunities, such as a PhD in a related field or advanced research training, to contribute to advancements in musculoskeletal oncology. A neuropsychologist is a clinical psychologist who specializes in assessing and managing the care of people who have had brain injuries or illnesses that affect their cognitive ability and behavior. You've probably heard them referred to by a more common name: ear, nose, throat doctors, or ENTs. Some of these doctors add on yet another specialty and become otolaryngologist head and neck surgeons, which trains them in surgery of the ear, nose, throat, head and neck, and facial plastic surgery. Pediatric otolaryngologists treat children with these problems. To become an otolaryngologist, also known as an ear, nose and throat specialist, the following qualifications, education and licensing are required. First, you need a bachelor's degree. The first step is to complete a bachelor's degree, typically in a science-related field such as biology, chemistry or pre-med. This usually takes about 4 years. Next is medical school. After obtaining a bachelor's degree, The next step is to attend medical school to earn a Doctor of Medicine, MD, or Doctor of Osteopathic Medicine, DO degree. Medical school generally takes 4 years and covers a broad range of medical knowledge and clinical skills. Then comes residency training. After medical school, aspiring otolaryngologists must complete a residency program in otolaryngology head and neck surgery. This residency typically lasts 5 years and provides specialized training in diagnosing and treating conditions related to the ear, nose, throat, head and neck. Licensing is next. To practice medicine, a physician must obtain a state medical license. This requires passing the United States Medical Licensing Examination, USMLE, for MDs or the Comprehensive Osteopathic Medical Licensing Examination, COMLEX USA, for DOs. After completing residency, many otolaryngologists choose to become board certified by passing the American Board of Otolaryngology Head and Neck Surgery Certification exam. While board certification is not mandatory, it is highly recommended as it demonstrates a higher level of expertise and commitment to the field. Continuing education is also essential. To maintain licensure and board certification, otolaryngologists must engage in continuing medical education throughout their careers, staying updated on the latest advancements in their field. Some may pursue additional fellowships. Some otolaryngologists pursue additional fellowship training in subspecialties such as pediatric otolaryngology, otology neurology, head and neck oncology, facial plastic and reconstructive surgery, or rhinology. Fellowships typically last 1 to 2 years. Finally, essential skills and qualities include strong communication skills necessary for explaining complex conditions and treatment options to patients, manual dexterity required for performing delicate surgical procedures, problem-solving skills important for diagnosing and treating a variety of complex conditions, and attention to detail critical for successful patient outcomes and surgical precision. By fulfilling these requirements, one can become a qualified otolaryngologist capable of diagnosing and treating a wide range of ENT-related conditions. Also known as physiatrists, these doctors have completed medical school as well as several years of additional training in the non-surgical treatment of problems with muscles, joints and nerves. These specialists take the whole person into account when diagnosing and treating a musculoskeletal problem. Conditions they treat include arthritis, back pain, neck pain, sports injuries, sciatica and carpal tunnel syndrome. A patient may see a PM and R physician as a first step in care or after consulting other specialists. To become a physiatrist, you must meet specific educational training and licensing requirements. Here's a detailed breakdown. First, the educational requirements. Obtain a bachelor's degree, typically in a science-related field such as biology, chemistry, or a pre-medical track. This usually takes 4 years. Complete pre-medical courses like biology, chemistry, physics, and math. Attend and graduate from an accredited medical school with a Doctor of Medicine, MD, or Doctor of Osteopathic Medicine, DO degree. Medical school typically takes 4 years. The first 2 years focus on basic sciences, while the last 2 years involve clinical rotations in various medical specialties. Next is residency training. After medical school, complete a residency in PM and R, which usually lasts 4 years. The first year is often a transitional or preliminary year in general medicine or surgery. The remaining 3 years focus on specialized training in physical medicine and rehabilitation, including musculoskeletal medicine, neurology, pain management, and rehabilitation techniques. Licensing requirements follow. Obtain a medical license by passing the United States Medical Licensing Examination, USMLE, for MDs or the Comprehensive Osteopathic Medical Licensing Examination, COMLEX USA, for DOs. Licensure requirements vary by state, but all physicians must be licensed to practice medicine in their state. Board certification is optional but recommended. After completing residency, you can seek board certification by passing the American Board of Physical Medicine and Rehabilitation exam. Board certification is not mandatory but is highly recommended and often required by employers. Certification must be maintained through continuing medical education and periodic re-examination. Some may pursue a subspecialty fellowship. Some physiatrists choose to pursue additional fellowship training in subspecialties such as pain management, spinal cord injury, sports medicine, pediatric rehabilitation, or brain injury medicine. Fellowships usually last 1 year. Finally, continuing education and maintenance of certification are crucial. Stay current with medical advancements and maintain certification through continuous learning, which includes earning CME credits and participating in professional development activities. Usually trained as an internal medicine physician or pediatrician, this doctor has gone on to receive extra training in the diagnosis and treatment of autoimmune diseases, which can range from osteoarthritis to gout to lupus. These diseases usually affect the joints, muscles, or bones, but they can also interfere with the eyes, skin, and internal organs. To become a rheumatologist, one must complete extensive education, training, and licensure requirements. Here's a breakdown of the qualifications needed. First, undergraduate education. Obtain a bachelor's degree with a focus on pre-medical studies, biology, chemistry, or related fields. This usually takes 4 years. It's essential to maintain a high GPA and complete prerequisite courses for medical school. Next is medical school. Attend and graduate from an accredited medical school with a Doctor of Medicine, MD, or Doctor of Osteopathic Medicine, DO, degree. This typically takes 4 years and includes general medical education and clinical rotations. Then comes the internal medicine residency. Complete a residency program in internal medicine, which focuses on training in general internal medicine and usually lasts 3 years. Fellowship in rheumatology follows. This involves specialized training in diagnosing and treating rheumatic diseases and typically lasts 2 to 3 years. Licensing is next. Pass the United States Medical Licensing Examination or Comprehensive Osteopathic Medical Licensing Examination to practice medicine. Obtain board certification in internal medicine by passing the American Board of Internal Medicine Certification exam. After completing the fellowship, obtain certification in rheumatology by passing the subspecialty exam from the ABIM. Continuing education is also essential. Engage in ongoing education and recertification exams every 10 years to maintain board certification. In summary, the total duration to become a rheumatologist is approximately 13 to 15 years after high school. This path ensures that rheumatologists are highly skilled and capable of diagnosing and treating complex rheumatic conditions.